Yeah.
Okay, hello and welcome to this webinar hosted and organised by the Active Citizenship Network and their partners, entitled Waiting for the Next Council Conclusions, Focus on Adult Immunisation. We have a really strong lineup of speakers to introduce to you later on this afternoon for this very timely webinar, which I think is a good week to have this discussion just ahead of the meeting of EU health ministers, where we expect and hope that they will discuss vaccination in some detail, and also at a time when healthy aging and healthcare resilience is high on the agenda. A little later we'll have a panel discussion, and if you'd like to ask any questions, use the Q&A function at the bottom of your screen. I'm sure you're all familiar with the Zoom tools by now, 2 years or more into using these things. So don't hesitate to ask questions, and during the panel we will get to as many as possible. But first, before that, let me introduce Mariano Vota, who is a director of the Active Citizenship Network, for his opening remarks. Mariano.
Thanks, Gary. Good afternoon and welcome to our appointment that is realized in the framework of the Vaccine Action 2022 European project focused on supporting the need for protecting the value of adult immunization and its gains. As you know, building on the Council recommendation of strengthened cooperation against vaccine preventable disease and important lessons learned during the last years of the COVID-19 pandemic, during its semester, the Czech presidency of the Council of the European Union intended to address these challenges. In particular, the expert meeting on vaccination, realized and held in Prague some days ago, 21st and 22nd of November, was an excellent opportunity to ensure that the vaccines are seen as a lifelong saving rather than a cost. From our perspective, even if not yet official, the Council conclusion on vaccination go in the right direction on reserving the necessary attention also to the adult vaccination. In fact, in the document called Draft Council Conclusion on Vaccination as the most effective tool for preventing disease and improving public health, which is to be submitted for adoption by health ministries 9 of December, has been highlighted that vaccination is not only important for children, but also in a life course perspective, and that there is no one-size-fits-all solution, and a sustainable investment effort in improving dialogue with citizens, understanding their concern, and developing tailored vaccination strategies is required. Moreover, the Council conclusion on vaccination will invite member states to promote health education on health literacy in a life course perspective, and first of all, to promote adult vaccination campaign to provide protection against transmissible infection disease that may be associated with serious outcomes such as measles, diphtheria, tetanus, or poliomyelitis. We can only be happy about this and thank the Czech presidency semester, which we have in our small way, we can say, constantly encouraged on the point since the day after they took office. And we will do the same during the upcoming Sweden presidency of the Council of the European Union, that we know they will take high attention to the healthy aging issues, to which, of course, vaccination policy for the benefit of the adult population are related. With the expert we invited, today we want to start from here to better understand what to expect and how we can activate in synergic way to implement this principle across Europe. The already mentioned meeting in Prague was anticipated on December 18 by the publication of the State of Vaccine Confidence in European Union. The institutions informed us that the vaccine confidence among the public and healthcare professionals is high across most population, with some exceptions and caveats. Across the European Union, the view that vaccines are safe remains higher than 2018 levels, even if an evaluation into the differences in public confidence between over 65 years old and 18-34-year-olds reveal key insight into increasing vaccine confidence gap, which needs to be addressed. The differences in vaccine confidence between 65 years old and the younger appears to be widening over time across many European member states, with the 18-34 years old becoming less confident between 2018 and 2022. Without any doubt, there are available indications that should guide our commitment to support public vaccination policies. At the same time, the Commission has launched a communication campaign of the lifelong benefit on vaccination against COVID, lesser seasonal influenza, and HPV, called United in Protection, which we appreciate, but in which, frankly, we do also have liked to a reference to the active role played by part of the civil society that spent itself in support of public vaccination policies, a reference that is unfortunately lacking. From our point of view, it is crucial to involve civil society actors in the discussion to recognize our role in support of public policy and for the benefit of the society. The goal to increase vaccination coverage can only be effective if the message reaches citizens. We need to identify how to better integrate patient advocacy groups, citizens organizations in vaccination-related initiatives to ensure that the hard work and progress reach a more general audience. Come back talking about adult vaccination in my country, in Italy. My organization, Cittadina Iniziativa, published some days ago some encouraging data. In fact, our annual report on the relationship between citizens and patients and the pharmacists in our country has shown that a sample of 1,030 pharmacists interviewed, the anti-COVID-19 vaccination as well as the flu vaccination is provided in just under 40% of cases. And the next challenge can only be greater involvement in the so-called routine vaccination. In this regard, more than half of pharmacists are in favor of introducing vaccination against herpes zoster, papillomavirus, and pneumococcus, as well as the 70% of the citizens interviewed who would see very well the involvement of the pharmacists in the three routine vaccination already mentioned. In this case, we are in the presence of indications to keep in mind in our common commitment to support public vaccination policies. Well, before giving the floor again to Gary, who has been supporting us for years and who I thank very much for this, let me say hello and thank to the Member of European Parliament, Fabio Massimo Castaldo. I know that he is delayed while he will join us in a couple of minutes, not only for to agree to stay. Hi, good afternoon. To agree to join us today, but first of all, for the decision to officially support the Member of European Parliament Interest Group, European Patient Rights and Cross-Border Healthcare. The MEP Castaldo certainly needs no introduction. I only remember that he was first elected to the European Parliament in 2014, where he was subsequently appointed Vice President in 2017 as the youngest Vice President in the history of the European Parliament. With my congratulations to the Member of the European Parliament, I finished my introduction and thank you for your attention. Excuse me again for my voice, but I stay in the middle of a seasonal flu, and I wish you an interesting webinar, and the give is yours, Gary.
Thank you so much, Mariano. Let's pass the floor straight to MEP Fabio Massimo Castaldo, who I think you introduced already as being a member of the Parliament Interest Group on European Patients' Rights and Cross-Border Care. MEP Castaldo, over to you.
Thank you very much to both of you, Mr. Finnegan and Mr. Votta. It is dear colleagues, dear friends, it is a great pleasure for me to be here with you today for exchanging some views and giving my personal contribution to discussion that is of a paramount importance, which is the adult vaccination. Before moving to the context of my intervention, I would like to thank the member of the European Parliament Interest Group on European Patients' Rights and the Cross-Border Healthcare, which I have proudly joined, as it has created the much-needed space for dialogue and also for the very warm welcome I received since I joined the interest group. I firmly believe that the moments of debate and exchange like this one of today are really fundamental to shed lights on the many complexities that are still affecting the field of adult vaccination Indeed, misconceptions and misinformation certainly play a role in making adult vaccination more complex than the prophylaxis for youngsters, but also a paucity of harmonized and clear rules and timetables at the European level do not help us at all in making these challenges less pressing. For over 200 years, vaccination has been one of the best ways for parents to protect their children from severe illness, hospitalization, or even death. However, vaccination is not only for youngsters. We know that very well. Some vaccines preventable diseases are particularly prevalent and serious in teens or adults. Vaccines are one of the best life-saving interventions developed, and they have been a revolution for modern medicine by preventing the spread of infectious disease and related deaths, both directly and indirectly, thanks to the community immunity or herd immunity. Vaccines are among the principal tools for the primary prevention of communicable disease, being highly efficacious and cost-effective. And I can be a witness myself of that because I have been deployed as observer in many countries of the world, in Africa and Latin America. So I was personally vaccinated to protect me and the others, for many of the most common against many of the most common disease of the area. Hence, promoting life course vaccination programs is essential, in my opinion, for the well-being of our citizens. The importance of such programs is underpinned by the knowledge that vaccines not only affect mortality, but also treatments of non-communicable diseases, NCDs, disability prevention, and antibiotic usage, eventually reducing antimicrobial resistance, often referred to as the silent tsunami. The significant positive cardiovascular protection provided by the influenza vaccine has also recently confirmed, and such secondary side effects deserve to be understood and more widely promoted. In the European Union, each country developed its own life course vaccine recommendations, which are less divergent for children than for older adults. A survey distributed by the Federation of European Academies of Medicine, the FEAM, in spring 2021, assembled data from European academies about current national adult vaccination schedules. And these data are, in my opinion, important because they clearly highlighted significant differences in vaccination policies in terms of age qualification, vaccine components, and frame of implementation and reimbursement procedures. Lack of consensus for some immunization schedules leads to reduced confidence in the entire adult vaccination program. The COVID-19 pandemic taught us how vulnerable our healthcare systems and economies are in face of an outbreak of infectious diseases. Now it is the right time to increase vaccine diplomacy. Indeed, our goal would be to contribute to the establishment of a common immunization programs across the whole Europe. It appears essential to insist on the importance of proposing harmonized adult vaccination program. Such science-based vaccine initiatives could favor healthy aging, protect older adults with comorbidity, and finally also reduce healthcare expenditures. Moreover, I would like to briefly focus on another important aspect of this debate. Today, digital and social media channels allow information to travel faster and further than ever before. I would add in that light, luckily, since this information revolution can be considered a milestone in terms of evolution of the humankind. However, these are some dark sides. There are some dark sides, as for instance, the possible amplification of false or misleading messages. Over the last few years, we have seen how this amplification can really deeply affect confidence in vaccines or against science in general. The fight against misinformation and disinformation is a joint effort involving all the European institutions, including, of course, the European Parliament that I do represent. The EU is working in close cooperation with the online platforms to encourage them to promote authoritative sources to demote content that is in fact-checked as false or misleading, and again to take down all the illegal contents or content that could cause physical harm to those who are watching them. The European Parliament has recently made important step forwards in terms of a proper common EU health policy and consumer citizens protection. But yet, a lot of work still lies ahead of us. That is why I decided to join the interest group and I look really forward to working very close together with all of you in improving citizen standards of living in the next years. I want to thank once more all the interest group and all the members and all the colleagues that are behind the organization of the interest group for the very warm welcome I received and for this kind of invitation of today. Unfortunately, due to other commitments, because today is a working day, extremely intense in the European Parliament, I will not be able to follow the whole debate, but I really wish you an excellent, fruitful, and rich of discussion and data and analysis exchange, and I can reiterate once more my commitment on the future initiatives. You know that I will really have the ambition to be a pillar and a strong support for the important activity of intergroup within the European Parliament. With my very best wishes, I really express the will to see a very fruitful and interesting debate today. Thank you very much, and see you soon.
Thank you so much, MEP Castaldo. That was really excellent. I'm glad to hear you mentioning misinformation. It's a topic close to my own heart, but also adult vaccination schedules and the differences across the EU, I'm sure, is something we'll come back to. We had a question already in the Q&A asking about a report that Mariano mentioned, and he has added a link to press release to a report that he referred to. He also mentioned European Council conclusions, which I think will come at the end of the week, hopefully, and also referred to the vaccine confidence survey that the Commission published quite recently, which I suspect may be about to get a mention again in a moment. So from the Council to the Parliament and now to the Commission, let me sorry, yes, as I said, Mariano already touched on some of this, but we will get to it now in a moment. Let me welcome Martina Ingvarson, who many of you will know already is a policy officer for disease prevention and health promotion at the European Commission. Martina.
Thank you very much, Gary. Happy to be here. Good afternoon to everybody. I'm pleased to have been invited to do a little intervention today at this event organized by Active Citizen Network. And as Gary just said, my name is Martina and I work as a policy officer on vaccination policies in the European Commission. I also participated in a roundtable on adult vaccination that was also organized by Active Citizen Network back in July. And it's good to see indeed that this increasing focus on the fact that vaccination is not only for children, but something that we can benefit from in all phases of life. And in addition, as was also mentioned before, we've seen very clearly during the COVID-19 pandemic that vaccination is not only a matter of individual health, it's also key to resilient and sustainable health systems, and maybe so much more as many healthcare systems also struggle with not having sufficient staff, and in that situation it's even more important perhaps that we are really getting vaccinated as much as efficiently as we can. And what I will do today is that I will share with you how the European Commission is working on vaccination in a life course perspective. And I'll also address to the extent possible the Council conclusions on vaccination, which are being done by the Czech presidency. When I say to the extent possible, it's because that, as you know, and as was also mentioned now, these conclusions, they're not approved yet. They are expected to be approved only during this Health Council that will take place at the end of this week. Vaccination is a national competence, it's a national responsibility, but the Commission supports EU member states in achieving or maintaining high vaccination coverage rates for public health reasons. And as you may all know already, and what was also mentioned, I think, by Mariano in the beginning, the Commission's work on vaccination, it's currently based on the Council recommendation on strengthened cooperation against vaccine preventable diseases from 2018. So that's right now, it's like 4 years ago. And this is something that we're still working on. There is a publicly available roadmap, and I'm pleased to say that almost all of the initiatives in that council recommendation have been implemented by now, which is good because the roadmap is coming to an end now in 2022. So this is something that we are wrapping up now, and I'm also happy to say that we have been able to sustain the activities despite of the COVID-19 pandemic. And as you know, this was a policy initiative that provides for a multitude of actions to be implemented by the Commission, by member states, and also by stakeholders to increase the uptake of vaccines. And this is an initiative as well that already takes or took a life course approach to vaccination. One action that I would particularly like to mention is the setup and also the further development of a coalition for vaccination, which consists of European health professionals and students associations. The coalition, what they are doing is that they advocate for vaccination towards both patients and health professionals, and they are in a very prominent position to do so precisely because they are healthcare workers. We know that health professionals, it could be doctors, nurses, pharmacists, they are trusted sources of information for many people, and they can also serve as role models getting vaccinated themselves. We unfortunately know that there is still a certain level of hesitancy among health professionals out there. The actions in this council recommendation from 2018, they were complemented by a joint action on vaccination, which officially came to an end now on the 31st of March this year. And this joint action also yielded a wealth of policy resources, not least in terms of addressing vaccine hesitancy. There was a whole work package dedicated to that. Our next step is the EU for Health program, which includes several actions on vaccination policies. As you may know, the planning of this health program is yearly, so we cannot say, we cannot by now mention all the activities that will be in there, but for the moment being, we have a call for tenders, for instance, about physical obstacles to vaccination, because this is something that we would like to explore. And this could also be highly relevant in relation to vaccination in a life course perspective. In other words, we would like to look more into what impact structural barriers can have on the uptake of vaccination, so that we do not only speak about perceptions and beliefs, but also we sometimes need to speak about how difficult or how easy it can be to be vaccinated in a certain country or certain system, simply to see if there are barriers that kind of prevent people from getting vaccinated, even though they are not unnecessarily unwilling to do so. This is part of the coin. Sorry, part of the story, the other side of the coin, so to speak. Then there's also the Europe's Beating Cancer Plan that you have, of course, also heard about. And in the context of that plan, the Commission will make a proposal for a council recommendation on vaccine preventable cancers. This will be an initiative that will particularly address cancer risks related to hepatitis B and human papillomavirus infections, and how these can be prevented by vaccination. I would also like to mention a new expert group on public health that the Commission will have. You may have heard already about the steering group on health promotion, disease prevention and management on non-communicable diseases. This is was not an old group, but it's a group that we have had for many years actually, and now this will actually be revamped so that it will have a broader mandate, and we will call it simply the Commission's expert group on public health. And what is key here is that this group will have a broader mandate so that it can also cover communicable diseases, including vaccine preventable diseases. And there will be a decision setting up this new expert group, and that decision is expected to be adopted also now in December. And as a key work strand, so to speak, this new expert group will have the collection, the selection, and the transfer of best or promising practices in public health, by using existing tools that you may also have heard about, for instance, the EU best practice portal. And in this context, we also see opportunities in terms of working on successful public health interventions in terms of increasing vaccination uptake. And what I have said actually many times already is that if there is something good about the COVID-19 pandemic, if there was any silver lining, it is that EU member states actually did invent a lot of new delivery models to reach people with vaccination where they are. For instance, with mobile units, I guess we all remember the vaccination buses who really provided vaccination to people where it was easy for them. In any case, there are surely a lot of interventions that could be used to also increase the uptake of other vaccines. Yes, so this is something that we're looking very much forward to explore. And actually the call for tender on physical obstacles to vaccination that I just mentioned is already using the best practice portal to collect interventions that reduce structural barriers to vaccination. This is a pilot, but we see similar opportunities in the coming years. And this is really something where I personally see a field of opportunities in terms of increasing adult vaccination as well, because we need to work on this aspect. We need to make it easy to get vaccinated for everybody everywhere. And as you can see, the Commission is already doing quite a lot to support EU member states in increasing the uptake of vaccination. And we're therefore happy that the Czech presidency chose to focus on vaccination as a health priority, and that they also decided in the context of this to do council conclusions. And as was just mentioned, I mean, the council conclusions, they are at a very advanced stage now, and they build on the work having been done on vaccination by the Commission and by member states in recent years. And they also take lessons learned from the COVID-19 pandemic into account. They are a strong political signal on the importance of vaccination, also in a life course perspective. And this is why we are indeed looking forward to seeing these council conclusions in their final shape already this week. So that was a little bit my input for today, and I am of course happy to take questions. Thank you.
Great. Thanks so much, Martina, for all of that. Interesting to see how the 2018 conclusions translated into so many actions from the Commission. What's the procedure, presuming we have new council conclusions to work from at the end of the month? How quickly do these translate into a roadmap or something for the future?
I mean, now there is a difference between a council recommendation and a set of council conclusions. I mean, for the council recommendation, we indeed had a full roadmap, a full plan for implementation. This will not be the case for council conclusions. They're not binding for the Commission. But of course, this is something that we have worked on with the Czechs, so that they were also kind of digestible for us. And there are some initiatives that we will definitely implement and also follow up on in the near future.
Great, thanks a lot.
In particular, perhaps I could mention this new expert group on public health, where we will have quite a lot of opportunities to, because it's a broad initiative, and there will be quite a lot of room to basically work on many vaccination-related initiatives. So okay. This is something. It is a field of opportunities for us.
Okay, and including hesitancy, is that something that could sit under their work?
Yes, indeed. And the council conclusions made by the Czechs, they have a focus on vaccine hesitancy. From Commission side, I might want to actually stress that vaccine hesitancy is a term that is there and which is useful. But we may also speak about simply how to increase the uptake of vaccination. And this actually goes back to what I just said about physical obstacles to vaccination, because when we speak about hesitancy, we very easily tend to put the responsibility on citizens, because then it's a lot about how I think and how I feel. And we also need to simply facilitate the access to vaccination. And then it's actually not so much a responsibility for citizens anymore. Then it becomes a responsibility for member states, for the Commission, and for those who actually develop vaccination programs and policies. Then it gets more tough, but it's important, and it really stresses the role of political commitment in another sense than when we just only speak about hesitancy.
Okay, great. Yes, some comments or questions. Well, just endorsements, let's say. I'll add these in from two participants. Yes, endorsing what you're saying about removing barriers to uptake. Of course, when we talk about hesitancy, sometimes we just hear confidence and trust in vaccines, but many of the barriers are practical, as you said. Okay, let's pause there for a moment and move to our next speaker, who I know is under time pressure due to many meetings at this time of year. It's a bit of a crazy week or two for everyone, I know. So let me introduce Niyazi Kakmak, who is a technical officer at the Vaccine Preventable Diseases and Immunization Program at WHO Regional Office for Europe, which, as you may know, is already a broader European region of 53 member states. Very welcome, Dr. Kakmak. Thanks so much for joining us. We've been talking about adult immunization and life course immunization, so maybe it would be useful to begin with a brief definition of what do we mean by life course immunization, and what are the benefits fundamentally of taking this approach to immunization.
Thank you very much, Gary, for the introduction. On behalf of WHO Regional Office for Europe, it's my pleasure to address through this webinar. Yes, life course approach to immunization recognizes the role of immunization as a strategy to prevent diseases and maximize health over one's entire life, regardless of an individual's age. A life course approach requires immunization schedules and access to vaccination that responds to an individual's every stage in life, to their lifestyle, and specific risks to infectious disease that they may face. When it comes to benefits, we very well know the direct benefits, the aborted diseases, prevented deaths from vaccine preventable diseases, but the benefits go beyond that. When we want to give some example to that, to those, for example, increased productivity, work days gains due to lack of sickness, healthcare cost saves that was referred earlier, increased care for others by ensuring health of adults. And what we know about adult vaccination from data gathered in Netherlands is that it has been demonstrated as fourfold return on investment. That is the return of adult vaccination. Life course approach also offers a platform to achieve global targets for universal health coverage through strengthening primary health care. High vaccination coverage offers benefits beyond the vaccinated individual, having the potential to protect whole communities through herd immunity. And comprehensive immunization across the life course may also offer sustainable protection against antimicrobial resistance, as referred earlier. These are the indirect benefits that we can list of life course approach. Over to you.
Great, thanks so much. So in terms of turning those into practice or into policy, how can these policies be supported in the European region of the WHO?
The life course approach is already embedded in broader immunization and health policy in the European region. The initial reference is the European Immunization Agenda 2030. Life course approach is one of the key pillars of the European Immunization Agenda 2030, which has been endorsed by all member states of the European region. That comes up with a visioning a world where everyone, everywhere, at every age, fully benefits from vaccines for good health and well-being. Life course approach to immunization, thus adult vaccination, contributes to achievement of European Immunization Agenda's 3 goals, which are known as reducing mortality, morbidity, increased equitable access to vaccines for everyone, contributing universal health coverage through strengthening primary health care. These are the 3 goals of the European Immunization Agenda. The European Immunization Agenda contributes to the implementation of a broader policy in the European region, which is called European Program of Work of WHO. And European Immunization Agenda is one of the 4 flagship programs of the broader health agenda. Both the European Immunization Agenda and the European Program of Work are integral part of global policies. Therefore, adult vaccination, not only in the European region, but also at the global level, it's supported by broader immunization and health policies.
And I understand, of course, it's member states who make the decisions at the end of the day. But going back to what the European Parliament speaker said earlier on, there is a big difference, isn't there, from one country to the next, particularly for adult immunization on flu vaccine uptake or the availability of pneumococcal and shingles vaccines. Is there any way to increase or even harmonize, which is a difficult word, but to make more similarities between countries and raise the standards across this large and diverse region?
Yes, the life course approach or adult vaccination is not something new as a policy within immunization, broader immunization policy. But when it comes to comprehensive implementation, we need more guidance in this area, better understanding. First of all, the foundational requirement at the country level is the existence of a conducive legislative environment and long-term cross-governmental commitment. So this is the foundational requirement. Besides this foundational requirement, there are some technical requirements that the program needs to have. These technical requirements are comprehensive immunization program policy that supports the life course vaccination through its national immunization schedule that is shaped by evidence-based decision. This is at the country level. Talking about harmonization of schedules, harmonization of adult vaccination, this may not work because the decision needs to be taken at the country level based on evidence. Referring to new vaccine introduction issue, there are 3 domains that you need to look at. You need to look at the disease burden at the country level. You need to look at the effectiveness of the available vaccine. And also you need to look at the programmatic issues. All these issues are local. That is why health and immunization decisions are left to the national level. It's very difficult to make a harmonization decision at the higher level, at the regional level. Besides the schedule that supports the life course approach, engaged healthcare professionals through education on benefits of the approach to immunization, public demand for immunization generated by awareness campaigns with engagement of civil society organizations. You have been referring to vaccine acceptance, demand issues, and as well as some service delivery issues. Program also requires robust data that informs the program policies through generated specific indicators and use of electronic databases that makes vaccination data available to all individuals and healthcare professionals. Last but not least, multidisciplinary and cross-sectoral coordination, as immunization being integrated into healthy living and healthy aging policies that is supported by all relevant sectors. So these are the technical requirements besides the foundational one, which is the long-term commitment, which is reflected in a legislative environment.
Okay, great. Thank you very much for all of that. Very useful. And thanks again for joining us. As I said, I understand fully you have to keep moving on to the next meeting. So it was good to have you with us this afternoon. I just see. Thanks again. I just see a question from Professor Pierre Van Dam, who is, you will know, from the University of Antwerp, noting that this discussion on barriers and practical issues about accessing vaccination reminds him of the underserved and hard to reach communities. And indeed, some adults can be both vulnerable and high priority and also still hard to reach. So, so this is a highly relevant point. But let's keep moving and we will go now to Dr. Jakub Dziergiński, who is from the Institute of Patients' Rights and Health Education, and also from Poland Breeds Healthily in Poland. And you're very welcome. Glad to have you with us. Maybe you'll tell us first a little about what is Poland Breeds Healthily and why is it focused on vaccination?
I think that I will start my speech fully supporting what Dr. Sagmat from WHO mentioned, that it should be the issue of life course vaccination agreed by the society, because usually we are talking about vaccinations for children, and we fully agreed in Poland, in other Central and East European countries, that this is the full understanding and full, let's say, commitment to do the children vaccination for free. And now, and you all also mentioned the issue of knowledge and awareness, and we have the refugees from Ukraine, and they have the full access to the health care because we are treating them as a Polish patients. They receive the social security and everything for free. And we observe the mothers delivering the babies in Poland, Ukrainian mothers, which are refusing of the vaccination because the knowledge and awareness and the Russian propaganda in Ukraine underlying the value of the vaccination. And Dr. Sagmat from WHO mentioned that this is the immunization schedule and the access. What it means access in such a countries like Poland and Czech and Slovakia and Hungary and Romania and Bulgaria, it means for free. When we are going to charge the patients for the vaccination, it's always difficult. It's always problem to fulfill the let's say the doctor's order or to follow the, let's say, the friend's advice or something like that. When we are trying to increase the awareness of the value of vaccination among the society, and we are going to charge for the vaccination adult population, we have the outcome like the OECD data that population, elderly population in Poland, plus 65. This is the 10% of vaccination against flu, 10% of the population 65 plus, compared to the average 40% for the OECD countries, and compared to Italy 53% and Netherlands 61%. which means that the access, it means the free vaccination for the people. And we need to increase this kind of awareness and strategy on the EU level, because we observe the COVID-19 situation. We observe the increasing number of deaths before vaccination, and then we are noting almost no deaths in Poland because of COVID-19, because the 60% of the population get vaccinated, compared to the 73% of the EU average. 60%. The COVID vaccination was for free for every citizen. And we see the outcomes of this kind of, let's say, opportunity. Even we have a lower rate for the vaccination in Poland compared to the such countries like Netherlands, Germany, France, etc. But this is 60% versus 73. The first booster, 33% compared to the 50%, which is not such a poor comparison, like 10% for the flu vaccination in the population 65 plus against 40 or 60%. And this is the first issue, the access. And the second issue is the let's say the pressure from the patient association. And we prepared the report as a institute for the patient rights, from the perspective of patient, oncological patient, cardiovascular patient, diabetic patients. And we, of course, based on the EU response to COVID-19 preparation for autumn and winter 2023 document. And of course, we also include the article prepared by Mr. Mariano Votta, published in August in the Vaccine Today. We must address vaccine preventable lung infections this winter. And we present this report as a perspective of patients, to convince the patients and the families that the vaccination of adult patients, especially against vaccine preventable respiratory diseases, is crucial for them. The flu, COVID-19, pneumococcal vaccination, and pertussis, which means that we're trying to change the mentality of patients in Poland and convince the families to get vaccinated. But even though when we are stepping into the details and somebody is going to the doctors, receiving the prescription for the vaccination, and vaccination is not for free, it creates another hurdle, which is very hard to overcome. And we achieve also the success in Poland that 12,000 of pharmacies, the open pharmacies, is open to do the vaccination. It's about the 1.5 thousand open pharmacies started to vaccinate people, which means that you are able to go to the pharmacy to buy flu vaccine and be vaccinated. But this is another issue. The pharmacies in Poland, they are not able to prescribe the prescription for the vaccination. We need to change this the legal let's say setting. And the pharmacies, they are very open to vaccinate the people, but we still don't achieve such a situation like the other European or in America countries, that you can get the vaccination, COVID vaccination with flu, which is the most sense, yeah. The patient sees the advertisement of the campaign, approaching the open pharmacy, asking for the 2 vaccinations, and receives immediately for free because it's insured. And I fully agree with Dr. Sagmak from the WHO. The access is a crucial thing, and we need to increase the political awareness of the investments into the vaccination, not because of every individual health, but the societal health. And we are after 2 years of pandemia, COVID-19, and we understand that individual health is very strongly connected with the societal health. And we are not even able to calculate what kind of economical and budgetal damage the COVID-19 did in Poland. Every estimation is undervaluated. And we do need to understand that on the EU level, 27 countries, and the European level, 23 countries, we need to build this kind of new wave of political approach. And I am very grateful that the MAP from Italy is so actively involved in this platform, because the politicians need to change the paradigm and approach for the vaccination, to treat vaccination as a background, as a basis for the safety of every society and every economy.
Thanks very much. Do you think, you said vaccination should be easy, should be free. Briefly, do you think a silver lining of the pandemic is that awareness of the need for vaccination amongst people with chronic diseases has increased?
Oh, yes, dramatically. When we are talking to the patients now, almost everyone is after second booster, which is good, because they understood that this is the matter of life and death. And now the understanding of the value of vaccination because of COVID-19 can be very strong argument for the influenza and pneumococcal vaccination and other vaccines. But we need to enable this kind of approach and access by giving the vaccinations for free. Because in our countries, when somebody needs to spend 50 or 60 or 70 euro per vaccination, and having some problems to get the doctor's prescription, and then went to the pharmacy, and then eventually find the money, it won't work. It won't work. And I think that the COVID-19 vaccination for free gave us the very solid argument that not everyone is going to be vaccinated, that government doesn't need to worry that it will be the blowout in the budget, because everyone will go and receive the flu vaccination, of pneumococcal vaccination, etc. But currently, it's very tragical. In Poland, only the full reimbursement of influenza vaccination, there are people plus 75, plus 75 only. Yeah. Even children have to copay. And influenza is for the pregnant woman for free, and which is not enough, for the pregnant woman, and you need to pay 50% when you are 65 plus 50%, which shows in the graph of OECD that in Poland 10% versus Netherlands 60%, and 18 to 65 with chronic condition, children up to 17, 50%. It should be changed. 100% of reimbursement. The pneumococcal vaccination for children for free, and for 65 plus with chronic disease 50%. Which means that even the people after 65 with chronic diseases, they don't have the free vaccination for community acquired to avoid of community acquired pneumonia. Which is not the way to keep the society healthy.
Okay. Thanks so much. We'll come back to you before the end. Just a couple of questions or comments in. Valentina Pezzenti points out that access-related issues sometimes are officially not in place, but in practice, due to health inequalities, there can, in fact, be access problems. And Pierre Van Damme, interesting one on, I suppose, the implied message of making vaccines free, and whether this could, whether the public might read this as being devaluing vaccines? It's an interesting question, and I see our next speaker is typing a reply already. Let's bring in Professor Catherine Ville-Olivier and let her give us her view on this already. Dr. Olivier is from the Coalition for Life Course Immunization. On that one, Catherine, do you want to say something on whether free vaccination, and you're on mute at the moment?
Many things have been said, so I will not repeat.
Okay.
What I like mostly in what has been said, I don't want to focus too much on hesitancy. I do agree that it's a sort of vast bag where you put a lot of things very different. And my questions are, many things are organized and well done at the level of Europe. And we go back on the field, and my impression is that there is huge gaps between what is underway at the European level and what is achieved in a country. I belong to a country, France, where the culture of public health is deeply missing in the public. So when we speak about vaccines, and this is very close to the human, it's not only science, but the end of the scope is the person who receives. And if you are not educated to understand that vaccines belong to promotion, the future, the fact that you will protect your family, your kids, your grandparents, your household in a whole, it's extremely difficult. And most of our communication are based on science. It's good for a scientific community, but we should learn more to speak the way that people may understand with their own sensitivity. And it's the major issue with those what we call anti-vax, though I wouldn't like to focus on this group, but they utilize a way of communication that could be inspiring for us. Instead of speaking of epidemiology, of percentages, nobody understands, or very few. So I would prefer to change the language we address to the public. For me, at any age, it's extremely important, as well as the notion of the group household, whatever is the content of the household, but covering all generations. For me, it's extremely important.
Okay. And in terms of all generations, could you tell us a little about the trends in Europe towards an aging society, and then the role of vaccines in keeping us all healthy as we age?
Thank you, Gary. We all know now that Europe is aging, that so far in many countries, depending on the country, you are between 20 and 30% people 60 or 65 plus. We are living a longer time in good health. So we have to develop this idea that we will age, but why not age well? And age is not a fatality. You can protect, you can manage it, you can utilize your best as much as possible. And it will have, for the side of stakeholders and politicians and economists, it has a real positive value on all the society. So aging is not a fatality. It's a reality, but you have to take care of it as well as possible. And obviously, vaccines belong to that, and vaccination. The second point is that in our public health system, we mostly envisage the curative part. And we all know that cancers, cardiovascular disease are the first cause of death in our countries, and they are costing extremely, they have a very high cost. When you compare the curative treatments on a whole with the cost of the whole life vaccination process, it's less than 5% for the vaccination. So we should, at the most important level, European level, negotiate with company to lessen the price of some drugs utilized for some months of life, later on at the end of life, and to push them forward to have less prices for their vaccines. And that could be, you move 1% only, and instead of less than 5% for what is called prevention, you will have 6%. And for 1%, you will have the capacity to protect much more people and longer.
Okay, and it's an interesting point. And someone said earlier on about the payback on the investment in vaccines. Why is it so difficult? We talk about this all the time. Is it because the payment is made this year, but the benefits are in subsequent years, or is it because you don't know who you saved? You know, it's not like a heart operation where you saved this patient. Is it some kind of psychological barrier that we can't connect the investment?
You are raising a very interesting point. Most of the vaccination schedules in adults and older adults are focusing on the so-called high-risk groups. And I think it's an error because it doesn't work on the field. Usually coverage rates or uptakes are insufficient depending on the country, but you do not reach your objectives. So you have to change because we want to protect everyone. It's a measure of equity. I read a comment from Pierre Van Damme speaking about the hard to reach. But the older people are hard to reach quite often. If you consider only nursing homes, in my country, we have 1.5 million people living in nursing homes. They are totally forgotten on the aspect of vaccines, mostly at least. And you have next to go to them. So I appreciate very much what was said previously. You have to go to see the people, discuss with them. And we are enlarging the role of pharmacists. In my mind, it's the first step to enter the health system. Because you don't have to get a rendezvous. You enter, you ask your point, you receive an answer. I hope it's good. And then you go back. And you don't need to see a doctor 3 times a day for many things. So it's a whole way to consider the care and the health of a whole population, including older adults.
Great, thanks a lot for that. I personally must agree. Our whole family of 4 went to the pharmacy. I'm in Ireland. The kids were vaccinated for free, and myself and my wife were not in risk groups, so it was a small fee. But it was really the convenience that allowed us to go. Getting an appointment with the GP is
it's getting more and more difficult.
Yeah, unfortunately so. Well, let's stick with aging, but broaden the scope to a more international outlook. And we'll bring in Dr. Jane Barrett, who many of you will already know is Secretary General of the International Federation on Aging. Jane, I can see you there. That's great. So you work on health policy in lots of different bodies, including UN and WHO level and so on. How do we embed these things we're talking about in policy at international level?
Look, thank you, Gary, and congratulations to ACN. It's a pleasure to be with you today. You know, already today we've talked about the Immunisation Agenda 2030. What we haven't talked about is the United Nations Decade of Healthy Aging. And it seems to me that we've also got an NCD, you know, report and alliance. And if we look across, we're looking at populations, healthy aging, and I take your point, Catherine, but also those with chronic comorbid conditions that are at risk of serious complications and death from vaccine preventable diseases. What we don't do well at an intergovernmental level or a regional level is we actually don't connect these intergovernmental agendas. So every country in Europe signed off to and endorsed the UN Decade of Healthy Aging, of which there are 4 action areas. One is combating ageism, and we know that occurred and still occurs in the pandemic. I'd like to take the point that, and Jakob really made the point in an indirect way about the disparity, you know, the targets. The targets for vaccines are quite different for children than they are for older adults. The second action area is long-term care. Catherine mentioned it. In the country that I live in, 90% of those who died in the pandemic lived in long-term care. We also know from our research, Gary, that across 34 countries, we do not have policies around vaccines and vaccinations in long-term care. The rights of people in long-term care facilities is exactly the same right that I have as an independent person. We have not addressed this population. The third area, age-friendly cities and communities, an age-friendly environment, is one where the pathway to being vaccinated, as Catherine said, is simple and easy. And guess what? It's accessible because the vaccines are free. But it's also an environment in which health literacy is taken into consideration. Our public health messages assume everybody has the same level of health literacy, and they don't. So targeted, refined messages. And the final action area is integrated care. Now, we also know that someone who is a diabetic going to a diabetologist, if the diabetologist said, I see that you have not had your pneumococcal vaccine this year, then that is the point of entry. And so instead of this complex system missing people or people falling through the cracks, coordinated care, integrated systems, combating ageism, looking at long-term care populations, and looking at the umbrella of age-friendly cities and communities. Just want to touch on vaccine confidence for just a minute, because it's been raised a number of times. My concern is that we use this umbrella word of vaccine confidence or vaccine hesitancy, when in fact there are modifiable risk factors that we could be addressing. So transportation is one of them. So I think sometimes for ease, we do this cookie cutter of, because they haven't been vaccinated, they must be hesitant. And for people in the older age group that don't speak English in my country, that should not be a barrier anymore. So we must be smarter with what we do from a health system perspective. We must inform, WHO and regional work about connecting these dots. So if you connect the healthy aging agenda with the immunisation agenda, it's a powerful force, because the IA 2030 does not talk about an implementation of a life course approach. It talks about life course integration, which is two different things. So I'm very passionate about this area, as you can hear. So thank you.
Okay, great. Thanks, Jane. What did you mean on transport, just out of curiosity, about getting people to the vaccine or the vaccine to the people?
Yeah, that's a modifiable risk factor,
Yeah.
Gary.
Yeah.
Because it's low-hanging fruit. So if the clinics were near public transport, it would be much easier. In other Hong Kong, it was a door-to-door for the pandemic, for the COVID vaccine. So instead of in my city, Toronto, we had long queues of people in the winter lining up. We actually have to, if we're serious about, healthy aging populations, we've actually got to look at the situational context of the environment, because healthy aging is about improving, maintaining function and creating an environment that enables an older person to do what they have reason to value. So we've got to look at the environment.
Okay. As Jakob and others said, making it easy, making it free, reducing barriers, it all makes sense. And so we're kind of in the third COVID winter, which is a terrible thought, really, but it's a different one to previous years because we're all out and about and doing things, and we see viruses and lots of them. Do you think, Jane, that the message has gotten out there that people can prevent many of the viruses that are putting people in hospital at the moment, like flu and COVID and so on, even if not all of them are preventable yet?
I don't think we have universal messages, that are targeting populations. I think there's a lot of confusion about what number am I up to? Am I number 4 or number 5 for COVID? Or, I've had COVID vaccines. Do I need the flu vaccine? And pneumococcal, well, I won't go because I'm having an influenza. So we come back to the fact that I believe that we still need to invest, in communication strategies, Gary, that are clear, that are targeted, and we need to understand the impact. We're good at making up messages, but we're not very good at measuring the impact. So impact for me, someone has been informed, made a decision, and then goes there. The other important aspect to what's happening in this environment is we've become very digital, haven't we? We're all into the digital. 37% of the world's population is not connected with the internet. Right? That is a barrier in and of itself. And much of the messaging, is still sitting on the websites and still embedded. So I think that, as we are in this flu season, it's not only COVID, we've got to remember the emergence of pertussis. RSV is a big, big surge, pneumococcal pneumonia, and we've got, 53%, of those that have had COVID are now long COVID, and they are at risk of vaccine respiratory preventable diseases. So we need to actually have a very clear focus that's science-driven and measured and evaluated. And I think that's in your bailiwick, Gary.
Okay, leave it with me. I'll solve that one.
Yeah, fix it up this afternoon, will you?
Yeah, thanks for that. But thanks so much, Jane, for that. I see Professor Paolo Bonanni has joined us. He may still be on the move, judging by his camera. Paolo, you're jogging somewhere to find a quiet spot, I bet. But let me introduce you, if that's necessary, to include one of your more recent additions, because you have a lot of hats, and that is as a co-leader of the Adult Immunization Board. But of course also at the University of Florence in Italy and other things. Paolo, very welcome and lovely to see you. Could you tell us what the objective is of this Adult Immunization Board?
Thanks a lot, Gary. Yes, I was traveling a little bit on foot because I had to reach the place where I'm staying for these few minutes. So thanks for giving me the word. And yes, I have to tell you about this newborn. It's a newborn adult immunization board. We had the kickoff meeting on November 8th, so just 1 month ago. And I would like to read what is our purpose, because it's a good definition of what we want to do. And the purpose of the Adult Immunization Board is to contribute to the reduction of vaccine-preventable diseases in Europe, in European adults, by providing evidence-based guidance on key technical and strategic issues, and by monitoring the progress of adult immunization programs in European countries, but not only at the European level, but at the country level and at the regional level. And the advisory board is composed of multidisciplinary and international group of core experts in adult immunization who set the strategy and define the actions of the board. And the board will offer a network for the dissemination of scientific information related to adult vaccination, focusing on Europe, first of all. I would like to stress that the contribution of these enthusiastic people is in kind. I mean, we are not, of course, paid for what we do, but we just want to offer our time to devote to the implementation of vaccination in Europe. I would say that now there is a lot of international consensus on the need of an adult immunization agenda. But what we lack probably is on the side of implementation. I mean, there are still a lot of barriers to implement adult immunization, and the Adult Immunization Board wants to intervene and to give technical advice, but also to go into depth in connecting with the people at the local level to understand what are the barriers and to learn from good experiences everywhere they are available. So. During the kickoff meeting, we had a brainstorm on defining what we want to do to achieve and what we want to do, and probably we would have food for 10 years of meetings and to go into depth into many areas that adult immunization implies. So there is a lot to do, and we are really very enthusiastic to try to implement adult immunization throughout Europe.
And earlier, Paolo, it was noted that while there is, some differences between childhood immunization schedules, the differences in adult access to immunization are much bigger. Do you see this? Do you see a big variation across Europe in recommendations on adult immunizations?
I think a lot of differences also according to the evaluation of priorities in the different countries, and also according to the evaluation of the health technology assessment that is performed in every country on this. So probably we need to learn, as I said before, to learn from each country. For this reason, I would like to make you understand how we will work on this, because we are taking profit of the long-standing experience of the Viral Hepatitis Prevention Board and the most recent, but it's still 7 years of life, of the HPV Prevention and Control Board. So these two boards were very successful in trying to put forward the implementation of, for instance, of vaccination programs against hepatitis B throughout the WHO region of Europe, and we wanted to take profit from the same experience. I mean, we are trying to convene experts and also observers from institutions. I mean, we are people from the university, from public health institutes, so from the academia, but also from the international institution. We would like to have, and we will have observers from WHO Euro, but also from the CDC. And we will have 2 meetings every year. One meeting will deal with the technical issues. For instance, how to set up a good register of vaccination for the adult immunizations. And the other one might be what should we do regarding pneumococcal vaccination, or so we could deal both with specific teams, but also with more general teams, advocacy, immunization for the travelers, and so on. And the other meeting, so one will be technical, and the other one will be a country meeting. So we will go to each country where we have to learn, and we will try to meet the local experts, the Ministry of Health, but also the local experts, and to learn from the experience of each country to see what we can export from that country to the other countries. But also understand what are the problems. So we could be instrumental in learning and also in trying to bring what we have learned from other countries.
Okay, great. Thanks a lot, Pello. And I think when we think of life course schedules across Europe, Italy's example of the calendar for life is a good one, and I know you were involved in that one, so I'm sure it will be part of the discussions you have next year. But thanks a lot for joining us. Time is running against us, as it always does. I'd like to come back very briefly to each of the speakers if you had a final thought. Perhaps if I could ask you how you think 2023 will look for adult immunization and for life course immunization. Will we make progress this time next year if we have another webinar? Will we say we maintained momentum, or are there still some problems? And just while you're thinking about that, I see Evelyn Donoghue has asked a question which is open to anyone who has an answer for this. What about vaccine caravans, she asks, and noted that there was one in North Macedonia. Perhaps there are other examples there too. Okay, let me, Martina, can I come all the way back to you and maybe some reflections or thoughts for next year?
Yes, thanks a lot, Gary. I mean, I'm afraid that this will depend a little bit on how COVID will behave. I mean, we're not out of a COVID pandemic yet, unfortunately. At least there's still reason to be vigilant. I mean, the good thing is that there is a high level of immunization in many countries. I mean, thanks to vaccination and thanks to previous infection. I think that we will have to make efforts on catch-up vaccination, and that will be both for children and also on for adults. I mean, maybe the word catch-up is a bit bad for adults, because I mean for catch-up we normally speak about children, but we will need definitely to refocus on all the other life-saving vaccines at our disposal. I mean, we also, I mean, I guess in terms of confidence, we know from this confidence report that the Commission just published that basically levels of trust are back to the level before the pandemic. but we see an age gap actually, so that younger people are less confident than older people. I mean, that's a good thing if you speak perhaps about vaccination for the elderly. On the other hand, it's of course not great. So there was also some damage on vaccination, on confidence in vaccines due to the pandemic, also because suddenly everybody was experts, and because due to all the misinformation out there. But to conclude a little bit, I hope that we'll be able to refocus on vaccination, and again, not only for children, but also for the elderly. I would like to stress again that I'm of course speaking from an EU perspective, which is different from a WHO European Union perspective. I mean, we know that, I mean, routine vaccination programs for children have not been that delayed in the EU countries. I mean, there were some delays in spring 2020, but overall, this is improving now. So I think we are, I mean, fortunately, we well on track, I would say. But of course, there can be some evaluations that have not been done yet. So I hope there will not be bad surprises, and I hope that we will be able to refocus on vaccination in a life course perspective.
Okay, great. I hope you're right. Let's see what next year brings. Catherine, maybe a final thought, if you had less than a minute, if you can manage it.
I am very in favor to be as close as possible to household, because if adults and older adults are aware of the benefit for promoting their health and good health and promoting their future, I'm quite sure that the children and especially teens uptake would be better.
Okay.
I am more doubtful about the catch-up policies. We do that on an individual basis, so we take every missed opportunity, and that should be the case at any age. Mm-hmm. For large catch-up program, it happens that in my country, it doesn't work well.
Okay, great. Well, you have experience in this, so we should all take note. Jakob, maybe a final thought, if you don't mind. And yeah, we're still against time, so be brief if possible. Thanks.
I think that I was talking about access to the vaccination, and Jane from Toronto mentioned that it should be delivered to the elderly population. And I think that 65 plus should be access for free to the, of course, COVID-19, but pneumococcal vaccination and flu. And it should be easy, friendly, user-friendly delivery, and just the total population covered. And I am very pessimistic unless the governments won't decide to cover, for instance, children and adults 65 plus with the full coverage, and then expand for the other population. But definitely as a target, free vaccination for every citizen which wants to be vaccinated.
Okay, thanks very much. Yes, as we're talking about European Council agreements and so on, there is, of course, a target of 75% for flu vaccine in older people. And of course, as you said, no surprise if you don't get there without paying for this. And of course, Poland, it should be said, has excellent pediatric coverage for children, but yeah, not so good, as you said, 10% for flu in adults. Jane, a final thought for next year. Sure. Predict the future. What's coming our way?
I'm ever the optimist. I'm the half glass full kind of person. You know, governments must be called to invest in infrastructure. It's gone down in the last 12 months. It must be actually inform the future, and that includes vaccines. I think about the next year in 3 buckets: prevention, systematic education, targeted messages; access, simplification of access, know your population, know how they receive the vaccine and where to go; and equity. We haven't talked much about the hard to reach populations, and they're not older people, older homeless, older women, older refugees, older migrants. So we need to actually pay attention to those as well. Prevention, access, equity with sustained investment. Thank you.
Super, so clear as ever, Jane. Thanks a lot for being with us. And with that, I will hand back to Daniela. I think I've brought everyone back, if I'm not mistaken. So let me just thank all the panel on behalf of myself for their participation, and to you for your questions, and give the final closing words to Daniela Kwaja, who you know is project manager at the ACN. Daniela.
Thank you, Gary. Just 2 more minutes. To say thank you after a year of work. First of all, thank you to you all to have participated. And so thank you to the ACN team for the work. Thank you to the companies for their support, GSK, MSD, Pfizer, Sanofi. Thank you to our media partners, Health Europe and Vaccine Today. And thank you to our friend and moderator, Gary Pinnegan. Our commitment on vaccination will continue next year and in 2020-23. Just a second to share 2 very brief slides, and I would say that our work will continue to support the need to strengthen the adult vaccination with new activities. And last but not least, please save the dates for our January events. The first will be on the 19th of January on health needs in inner areas between health desertification and National Plan of Resilience and Recovery. The second one will be the 27th of January about facilitating the process of patients' access to clinical trials data and to manage the reuse of data. It's a new EU project. The last one for January will be on the 31st about the therapeutic adherence during the COVID-19 pandemic across Europe with experiences and perspective for PAGs and relevant stakeholders. So thank you very much and goodbye to everyone.
Thank you so much.
Thanks, everyone.
Thank you very much. Thanks, Gary.
Thank you.
Thanks, Daniela. Bye-bye. Thanks, Mariano.
Thank you also.
Thank you. Bye.
Bye-bye. Bye-bye.
Bye-bye.